Okay, well, welcome everyone. We're so happy that we're able to provide this talk today. And we're so thrilled to be hosting Raúl Hernández, the Community Outreach and Clinical Research Coordinator for the Partnership Community Outreach Research and Education Core of the City College of New York and Memorial Sloan Kettering Partnership. This is an incredible program that I believe for 10 years or so, has been promoting access to cancer services and encourages and supports health behaviors which enhance quality of life for diverse underserved communities. And we're so pleased that he's here with us today and will be talking with us about healthy living for cancer prevention. And we're hopeful that this will be the first of several webinars that Raúl will join us for, and that we'll be able to provide that really speaks to health and migration to support our communities. So I'm going to not take up any more time and turn it over to Raúl.
Thank you. Thank you so much. What a wonderful introduction. Yeah, we're just so happy and thrilled to be here today. My name is Raúl. And yeah, of course, I am a community outreach coordinator. I've also been a health educator for the last 10 years. I've worked in the Bronx in New York City. And I have worked with families, adults, parents, children, adolescents in schools and high schools and community health centers here in New York. And so I'm just very thrilled to start off with healthy living for cancer prevention. This is really just a talk that's a little bit more general to get folks introduced to the idea of what healthy living means, not only for cancer prevention, but for many, many other chronic conditions as well. We know that being healthy, right, is one of the indicators for having not just a productive and lovely and wonderful future and well-being, but it also can prevent cancer in some ways, prevent chronic diabetes, hypertension, and many, many other diseases. And so I want you to approach today's talk not just with the cancer focus, but just in general, it could improve your life in many, many ways. So thank you for joining. Just a little bit about Zoom. In case folks need a reminder, you can always ask me a question during the presentation. You can ask a question in the chat by clicking this button down here and talking to our staff in the chat. You can also unmute at any point if you want to ask any questions. I'm happy to interact with participants. This is a 20 to 25 minute talk. And so I would rather hear from folks as we go along. I may not know all your questions, but I'd be happy to check with our staff and get back to you at some other point if we don't have the question answered for you today. But feel free to interact with us. And of course, if you want to raise your hand, feel free to. You don't need to raise your hand. This is just something in case you feel motivated and moved to do so. You can raise your hand, clap, smile, whatever you want. Send us a heart. We would love that. So thanks. Okay, so yes, today this is what we'll talk about: healthy living for cancer prevention. And I am from the City College of New York Memorial Sloan Kettering Cancer Center Partnership. We do outreach in the community. We connect folks to free cancer screenings in the community. Doctors, insurance. We have a partnership with Memorial Sloan Kettering's Immigrant Health and Cancer Disparities. And so we work very closely with many different immigrant communities in New York City. And so, yeah, thanks for joining. So very quickly, what is cancer? What do we know about it? I know there are many sometimes misconceptions, myths about it, but the science shows that cancer is a term that's used for diseases in which cells divide without control. So these are tiny little cells that are found in our body, right? Everybody has cells. And these cells tend to divide. For example, your skin is made up of many cells, right? Over time, over days, these cells multiply and divide, which is normal. However, when someone has cancer, these cells become abnormal. These cells multiply, like in this picture right here, and they multiply without control. So they become bigger and larger, and sometimes they turn into tumors, right? Some of which are benign, meaning they are not bad, right? But sometimes they turn into malignant cancers, which can be something more frightening and scary, but can be treated with treatment, surgery, medication, what have you. And cancer can also be removed if it's caught early. We do know that cancer is the second leading cause of death in the US. And so it's very important to understand a little bit about cancer, but also understand how to reduce your risk of having it in the long run. So what are some risk factors, right? So a risk factor is anything that increases your chance of developing cancer. So here we're going to talk a little bit about these different cancer risk factors. Knowing how these different risk factors affect your risk for cancer can empower you to lower your overall risk of cancer. And we know that at least 18% of all cancers in the US are related to risk factors that can be changed, that can be modified. So that's 18% of cancers that can be maybe prevented, or their risk can be lowered by changing a couple of things in your everyday life, right? And so on the left side, we have modifiable or changeable risk factors, things that you can do in your own life to change, to lower your risk. So that's diet. By diet, we don't mean, like the Beyonce diet. We don't mean like, put a little bit of cayenne. We mean nutrition, right? Physical activity. So exercise, movement, dancing, all of that counts towards physical activity. Alcohol. So alcohol use is actually related to cancer as well. And so changing the way you drink or modifying the amount of drinks that you do have, if you do drink, can alter your risk for cancer. Sun exposure, of course. We know that the sun and ultraviolet radiation can cause different types of cancer, and viral infections as well can also cause cancer. Things that unfortunately we cannot change are things like our age, right? Our sex that has been assigned to us at birth, and our family history. And we'll go into detail as we move along. Okay, so the first thing we'll talk about is diet, right? And this is, like I said, not just related to cancer, but also diabetes and chronic hypertension, right? So what do we know? We know that keeping a healthy weight can help maintain overall good health. But when it comes to cancer, research shows that being overweight or being obese can raise someone's risk of getting some cancers, including uterine, breast, and colorectal cancers. In fact, most cancers associated with being overweight were associated with being overweight, while other cancers, most cancers that were associated with being overweight increased, while other cancers decreased between 2005 and 2014. So what can we do to eat healthy, maintain our weight, and how do we do it, especially right now during COVID, right? We know that a lot of folks are having a lot of difficulty accessing food, making sure that we have, this whole plate represented on our tables, right? But I do want to encourage, even if you don't eat this exact food, right? We know that many of us, I myself am of Mexican descent, and so I definitely did not grow up eating spinach or kale, but I did eat a lot of lettuce, right? I did eat a lot of lettuce. I did eat a lot of tomatoes, a lot of carrots. And for me, I would take out certain parts of this and say, okay, what do I see on this left-hand side? I see that half of this plate, right, consists of fruits and vegetables, right? So half the plate should be fruits and vegetables. And that can be anything that's green, red, orange, right, into your diet. So make sure to include, like we say, many different colors into your vegetables, right? And they can be frozen from frozen. They can be from a can as long as they're low sodium, low sugar, or they can be fresh as well. So they all have the same amount of nutrition when you do eat them and when you cook them, okay? Eat protein-rich foods. That means, that can be anything from meat to eggs to tofu to soy to fish to beans, right? I know growing up, I ate a lot of beans, right? Beans and rice and tortillas and chicken, but we know that about a quarter of your plate should really be these lean proteins. So proteins that don't have excess fat or too much fat, okay? So we really mean things like fish or chicken without skin, or reducing the amount of red meat that you do eat, right? So all that is very, very important to staying at a healthy weight. And definitely we encourage you to limit red meat and pork products. And that is very, very important. Especially when it comes to, in Spanish, we say embutidos, but these are like sausages, right? Things that come in, packages like hot dogs, chorizo, brats. Unfortunately, these products have a lot of preservatives, especially if they're made in a factory, if you buy them in a store. And they also have a lot of other components that we are not quite sure what's in them. And so we know that red meats, pork products, sausages can increase our risk, not just for cancer, but for colorectal cancer. And so it's very important to lower that amount of those meats in our diets. And as always, right, choosing your whole grains is really important. That means, things like oatmeal, avena, brown rice, if you like it, quinoa, things like that. Making sure that we're eating these very nutrient-rich whole grains, right? Because we know that white rice, although it's delicious and I eat it sometimes, it doesn't have the most amount of fiber, right? And it doesn't have the most amount of nutrients in it. Because when we turn it into white rice, we really take out the outer shell of that grain, which has all the nutrients and all the wonderful ingredients that really make us very, very healthy. Okay. And of course, limit your juices, your sodas. Remember, just drinking water is the best, but if you can't, definitely flavored seltzer is also very, very good. And limiting the juices and the sodas just to, help us reduce and lower our weight. But I know it's difficult, especially in the pandemic, thinking about how to lose weight or stay healthy, right? We know that a lot of us maybe still isolating or maybe not going outside as much, but it's still important to do so safely, right? And so exercising, going out for a walk, going up and down the stairs in your apartment building, those are all excellent ways of staying active, right? You don't necessarily have to go to the gym. We know that to be able to stay active and stay moving, right? And setting small goals, whether that's, hey, I'm gonna walk from here, from 145th Street, which is where I live, to 155th Street today. Tomorrow I'll go to 156th Street, and little by little increasing those goals will help you just incorporate more and more physical activity into your everyday life. Here at the bottom, we have the recommendations for the different age groups, right? So for children 3 to 5 years old should really be exercising 3 hours a day. That sounds amazing. I wish I had 3 hours a day to just to move and exercise. That sounds wonderful, but they really should be getting that every single day. For young people, 6 to 17 years of age, it should be about 1 hour of moderate to vigorous activity. So that's, playing soccer, playing basketball, running around, chasing each other. That should be about 1 hour a day. And muscle strengthening about 3 days per week. So that can be, doing the monkey bars or for teenagers, doing pull-ups, push-ups. That should be about 3 days a week. For adults 18 to 65, we recommend about 2.5 to 5 hours of moderate activity. So that's walking. And then 1.25 to 2.5 hours of vigorous activity. That's, more jogging, running, biking, briskly walking, moving a little bit quickly, about 1.5 to 2.5 hours a day. Okay, great. The next thing we'll talk about is tobacco use. And although, a lot of people may not be smoking as much anymore, there's, we still are, in New York City. And so we're surrounded by people who do smoke. And that, we do have to remember that cigarettes are usually make up most of the cases of lung cancer, right? So most people who have lung cancer, almost a majority of them, were smokers in the past, right? We know that cigarettes are very unhealthy. In this picture below, we have all the ingredients, right, that are found in a cigarette. And so some of the ingredients include cadmium, which is something that is found in batteries. We have ammonia, which is what we use to clean around the house, paint, arsenic, which is a poison, and many, many other toxins, right? So not only do these ingredients and do cigarettes cause lung cancer, they can also cause other types of cancer like mouth, throat, esophagus, stomach. Think about every time someone smokes, right? That smoke not only goes through your mouth and your lungs, it goes through your esophagus, right? It goes down to your stomach. And so these are all areas that can be affected by that tobacco consumption. But if you do smoke, you can always reach out to not only a friend or a colleague, you can reach out to us in the partnership. We also connect you to free tobacco cessation counseling. We also provide free patches, free nicotine patches to anyone who's interested in quitting. We know that the benefits of quitting are almost immediate. And so you will start feeling better as soon as you stop quitting. And we have counselors who are here and open and willing to support you as you try to leave cigarettes and tobacco behind. And let's not forget also that these days, tobacco doesn't only come in the form of a cigarette, it also comes in hookahs, e-cigarettes, and chewing tobacco as well. And so all of these contain these harmful carcinogens, which are these ingredients that can cause cancer. So it's very, very important that if you are looking for support and know of someone who needs some support, feel free to reach out to us. We're happy to connect you to a counselor and to free services to help quit. And now, alcohol. Sometimes this is a little bit of a controversial topic because sometimes in the news we've heard, hey, red wine, can do this. It can be good for your health. It can be good for your heart. But unfortunately, the fact is that any type of alcohol, whether that's red wine, beer, port wine, liquor, they all raise your risk of developing cancer, and not just one type of cancer, not just liver cancer, but 6 different types of cancer, right? And that's because all alcohol damages the cell. However, if you do choose to drink, right, we do recommend that you drink in moderation. So that means drinking 1 drink a day for a woman or 2 drinks a day for a man, right? And this is usually the rule that we like to stick to. But if you can avoid alcohol altogether, even better. But we know that certain situations, social functions, right, going out after work or hanging out with friends may be a little bit difficult. But definitely, if you can stay to these recommendations, your risk of getting cancer will not be as increased. Okay, and I know we're getting out of the month of September, August, July, out of the summer, but it's still important to know, right, that any type of sun, right, whether it's an October sun, a November sun, or even the sun that's shining off the snow in December or January, all those rays, right, have UV radiation, right? And that radiation can cause skin damage. So anytime you go out, right, especially to the beach, especially for prolonged periods of time, but anytime you do go out into the sun, it's important to not only wear sunscreen that's at least SPF 15, right? So these lotions that you put on the body are very, very helpful, right? That protect you against the sun's rays. But it's also important to wear things like hats, so your head is protected, right? Sunglasses, so your eyes are protected, and long sleeves, so wearing long sleeves to cover yourself up from the sun. As we know, even people of color, people like myself, and Black people, right, also can get skin cancer. So it's very important that everyone stay protected and use suntan lotion. I see there's a question in the chat, right? It says, is there a medication to prevent cancer? So that's a great question. So, there is not one medication that will prevent you from getting cancer, but, a lot of people do know, for example, in their family sometimes that cancer is something that does come up, right? So some people will say, I know of my mother or my sister, they both had, breast cancer. Should I talk to my doctor about it? And the answer is yes, you should definitely talk to your doctor about it, right? Something because your likelihood of getting cancer may be higher than anyone else, right? And the doctor may offer you different ways to look for cancer before it's even there, right? And so they'll offer you tests, screenings, which we'll talk about. at an earlier stage, right? So that they can find anything before it turns into anything that's too late, right? So if they find something early, they'll be able to remove it and take it out, and your chances of being healthy again are going to be great. And so while there is no one medicine to prevent cancer, there are different screening methods, and I'll talk about one in particular that can prevent cancer, like the colorectal cancer screening. And viral infections. So something that's not as talked about, but we know that certain viruses, right, certain infections from viruses can lead to cancer. But here today, I'm going to talk about two in particular. And the first one is HPV, the human papillomavirus. Okay, and we know that the human papillomavirus has been associated with several throat and genital cancers. And it can happen to both men, it can happen to women, and in women, it actually leads to cervical cancer, right? So this is a virus that can be transmitted from person to person and can eventually lead to something like cervical cancer. And in men, it can actually turn into a genital cancer, like a penile cancer, or even an anal cancer as well. However, we do have a vaccine that can prevent this particular cancer from happening, right? So the HPV vaccine is recommended to boys and girls starting at the age of 11, right? And you can get it up to the age of 26. Most insurance plans will pay for the vaccination up to age 26. At our center, at the Waffle Run Center, adults can actually get this vaccine up to the age of 40. And so this is something that is available to teenagers, young people, and even adults, right? And this vaccine prevents you from getting these cancers of the throat and the genitals. And so back to your question, right, from the chat, is there one medication that can prevent you from getting cancer? There's not one that can prevent you from getting all the cancers, but there is a vaccine that can prevent you from getting cancers that are related to human papillomavirus. And so I strongly recommend it to anybody, any family member, any parent who's thinking about getting their kids vaccinated. It is a very safe vaccine. Tons and tons of adolescents have gotten the vaccine, and it prevents you from getting cancers of the throat and genitals as well. The second type of virus is the hepatitis B virus, right? And hepatitis B can actually lead to liver cancer if it isn't treated. And so for many of us, the hepatitis B vaccine can be taken. So if a baby is born, a newborn, or even a child and hasn't received a hepatitis vaccine, they can also receive that hepatitis vaccine that can prevent them from having complications with their liver, which will eventually lead to liver cancer. And so this vaccine is available to all recommended age groups. So feel free to ask your doctor. If you feel like you haven't had this vaccine before, feel free to ask your doctor. And if you don't have a doctor, again, we can connect you to a doctor near you, so that you can be, so you can get your physical. I know in the last year, it's been very hard to get an appointment with doctors. So I would highly recommend reaching out to us if you need an appointment. Okay, and I see another question. It says, what can men do to prevent prostate cancer? And that's a great question. And so we do have, especially knowing, I will get into this a little bit more, but understanding your risks for prostate cancer, your personal risk, right? And I don't mean just like, your neighbor's risk or anyone else. I mean your risk, right? So as a man, right, I need to ask myself a couple of questions. Do I have a brother? Do I have a father who has had prostate cancer, right? And if the answer is yes, you should definitely start talking to your doctor more often about getting a prostate cancer screening, right? If, for example, you're a man of African descent, your risk is a little higher of getting prostate cancer. So you should talk to your doctor about screening for prostate cancer. And we'll talk about the screening. So the screening for prostate cancer is a blood test that can be done to see if there is any abnormality or anything that's wrong, right, with your prostate. So that's definitely something that men can do to stay on top of their health and their prostate health. Absolutely. There's another question in the chat, and it says, people usually say that when you are breastfeeding, you have a chance to get cancer. But I know a woman who breastfed all her 8 kids and she has cancer right now. Is there any explanation on that case? Yeah, that's a great question. I know that actually one of the things that helps reduce your risk of having breast cancer is having children, right? So having children will actually reduce your risk of getting cancer. And so I have never heard of breastfeeding as a risk factor for breast cancer. Sometimes breast cancer runs in families. Sometimes it just happens. The cells are damaged, as I said earlier. And so I don't have any, there's not that I know of, there's no explanation, no correlation, no connection between breastfeeding and breast cancer. Actually, breastfeeding is highly encouraged, right? It's really recommended to if you want to and if you would like to begin breastfeeding as early as possible. I know not everyone is able to do so, but if you can, definitely encourage breastfeeding. It's very, very important. Thank you for your question. So we'll talk a little bit about family history next. So it's very important, right? When we pass down stories from people, right? Whether that's, the story of how my dad came to this country from Mexico when he was 23, right? I love hearing it. It's such a, it's inspiring. It makes me feel grateful for where I am today, but it's also important to know the different conditions that he has, right? The different medical conditions, illnesses that he had, and that he can tell me about as well, right? So he can tell me, that he started getting hypertension at the age of 35. And so he started medication to treat it, right? My mom can tell me that my grandparents, right, have a history, all of them have a history of diabetes, right? So it's important for me to know that so that I can take care of myself, talk to my doctor about these histories so that they can help me prevent that from happening, right, to me. Not only that, it's also important to hear about any cancer that's happened in the family. So whether that's breast cancer, colon cancer, rectal cancer, or prostate cancer, it's really important to hear that from your parents or a family member so that you know what your risk is for getting that cancer. We know that knowing that information is a good first line of defense in preventing certain cancer. Your risk for getting cancer can increase if you have a parent, a sibling, or a child that has had cancer, or if a family member was diagnosed before age 50, or several relatives have been affected. We also know that certain genetic mutations, for example, the BRCA1 and the BRCA2, which are these two, it's a name for these genes, right? That are usually passed down, that are responsible for breast cancer. And so you can actually get tested for these genes if you believe that there is a risk of this gene being passed down from generation to generation. Doctors can actually test you for these genes to see if you have it. And if you have it, they can counsel you, educate you on ways to reduce your risk of getting breast cancer, right? Whether that's taking medication, whether that's screening more often, whatever it is, right? Knowing this information can help you, can help defend you from getting certain types of cancer. Okay, so now we'll talk about checking for cancer, and these are typically called screenings, right? This is a way to check for any abnormalities before a person shows any signs, any symptoms of any cancer, right? We know that getting your screenings done regularly, on time, is the easiest way to find a cancer that is treatable and curable. And it's important to talk to your doctor about how and when to screen, right? So we currently have several different screenings, right? And I know someone asked about prostate cancer. So that's definitely a screening that is recommended, especially for men of African descent. They should start that screening at around age 45 But most men, right, will start talking to their doctor about it at age 50. For colorectal cancer screening, we've known now that the screening should be started at 45 years of age. And that's because we've seen a lot of younger and younger people start getting colorectal cancer screening. Okay. We can also do skin checks, right, with your doctor or dermatologist to see if there are any abnormalities with the skin, lung cancer screenings if you're a smoker. You can also request for a lung cancer screening, which is a simple scan of the lungs to see if there's anything there. For most women, they can also get a mammogram starting at age 40. But if you have a family history, for example, if you have a sister, a mother who has had breast cancer, your screening will start approximately 10 years before the age that they had breast cancer. And so if your mother had breast cancer, for example, at age 45, your screening would probably start at around age 35. Okay. And then for cervical cancer screenings, women ages can start getting those screenings done at around age 21, right? So we have two different types of screening tests. The most common one is the PAP, the Papa Nicolau, which can be done every 3 years. We also have the HPV test, which can be done every 5 years, okay? But it's important to talk to a doctor about when you should start screening and how often you should start screening. But where can you get screened? So where have been talking about cancer, we've been talking about screening as a way to find cancer early or even prevent it. But where can you go to get screened? So these are all different locations here in the 5 boroughs where you can go get screened. A lot of these are health and hospitals corporations, and you can call these numbers to see if you can make an appointment for a cancer screening. But I know many of you have already signed up before the event. You already RSVP'd and registered for the event. So some of you may have indicated that you want a cancer screening. And so if that's the case, we will connect you to either our partner in Harlem, which is the Ralph Lauren Center, where they do free cancer screenings. Or if you want something closer to your home, we're happy to connect you somewhere closer to your home as well, if you want an appointment for a cancer screening. And so currently at the Ralph Lauren Center, we do screenings for breast cancer, so that's mammograms. We do screenings for cervical cancer, so that's the PAP test. We also do screenings for prostate cancer, right, which is the blood test. And we also are doing colorectal cancer screenings, right? So we also do that for men and women. So very important. If you're looking for one, feel free to reach out to us, and I'll leave my I'll be happy to leave my information in the chat as well. Okay. Okay, so we know that, we offer free cancer screenings, but how about outside of our center? How much do they cost? So most insurance plans, if you do have insurance, should cover the cancer screenings, right? We can also help you find out if your insurance will cover the cost of the screening. So screenings don't typically, you can't get a screening usually at any age. Screenings start at certain ages. So as I said, for a mammogram, those usually start at age 40. And so insurance funds will start covering mammograms at approximately age 40. And so that means that there's usually no payment or very low payments, depending on how your insurance is set up. But if you have any trouble paying for them, or if you need something that's free, or if you're undocumented or whatever, right? So if you have any issues with paying, you can come to us, you can connect with me, and we can make you an appointment to get a free cancer screening at our center in Harlem. This is my information. This is my phone number. We obviously do cancer screening. We also do health education, connecting you to a doctor. Feel free to email, call us. We can help you make an appointment. We can also help you find health insurance. And so I'll very quickly go into that to talk a little bit about accessing healthcare here in New York and different options for health insurance and health access programs. So here in New York State, we have a marketplace for insurance, right? That's called the New York State of Health Marketplace. Our team can help you see if you qualify for insurance, including free or low-cost coverage for Medicaid, Essential Plan, and Child Health Plus. In New York City, we're very lucky. We have something called New York City Care. It's a healthcare access program that guarantees low cost or even no cost services offered by New York City Health and Hospitals. It covers preventive services, for folks, and it's usually free. I haven't seen a person yet that has had to pay. It's usually free, and it's available to people who don't qualify for insurance on the marketplace. So for the marketplace in New York State, you must live in New York. You must be a US citizen, a national, or a lawfully present immigrant. Different immigration rules may apply if you are eligible for Child Health Plus or New York State Medicaid or the Essential Plan based on your income, and you must be under 65 years of age. For New York City Care, you must have been living in New York City for the last 6 months or longer. You must not qualify for any health insurance plan available in New York State or not be able to afford health insurance based on the government guidelines. If you are interested in applying, you can reach out to our colleague, Chanel Martinez, at martinc1@mskcc.org, and that's her phone number. You can also reach out to me. I'm happy to connect you, and they speak English, Spanish, Arabic, French, Mandarin, Cantonese, and Bengali in the program. And yeah, that's the end of my presentation. Thank you. I'm sorry I talked so much. I'm ready for your questions. I hope I can answer them.
If anyone wants to go on screen and ask live, otherwise we have a couple of questions in chat.
A quick question about the HPV vaccine. I think I had heard that it was recommended for boys and young men as well. And I think that's just because of transmission. But if you can just explain that a little more, because I know, it can lead to cancer in women and females. Did you say that it can also lead to certain types of cancers in males too?
Yeah, so that's absolutely true. So the HPV vaccine is definitely given to both males and females, men and women. And because it is a transmittable virus that is passed from person to person, the HPV vaccine should be given to all. And it prevents cancer in all. And so the types of cancer for women would be cervical cancer, but for men, the HPV virus can lead to things like penile cancer and anal cancer as well. And so this vaccine could prevent men from getting those cancers. And I know there was a question. I hope that answers the question.
Thanks.
There was a question in the chat about PAPs. And so since we're on the topic of cervical cancer, I'd also like to talk a little bit about that. Pap smears or PAPs are usually given to screen for cervical cancer. So that is a test that is given to anyone who has a cervix to screen for cervical cancer and only cervical cancer, right? And that's different from a mammogram. The mammogram is another screening tool that uses X-rays to detect breast cancer in women. And so the mammogram is only for breast cancer and the PAP is only for cervical cancer. So those are two different types of cancers and two different types of tests for those cancers.
You see the question about the from cavities or bed root canal, can you get a cancer from this type of treatments or something happen like in your oral surgery, I guess?
I'm not sure. I haven't heard of that. I haven't heard of cavities or treatments or oral surgery leading to cancer. But, there may be, other conditions that may have required oral surgery. And so, but I haven't heard of any cavities or root canals leading to cancer myself. But I can definitely check and see.
The question why they don't, I think the question is about why they don't screen patients under 40, for example, by ultrasound for breast cancer.
That's a great question. Yeah, so the screenings usually start at age 40 because that's usually when the number, that's when more women start showing signs of cancer. There's evidence. So the screening guidelines are really based on research and evidence that shows that screenings are useful at a certain age. And so sometimes when doctors start doing screenings before those ages, they either one, don't find anything and they just cause stress and sometimes nervousness related to the screening, or they find other things are not related to breast cancer that are maybe normal. But that may also cause fear in women. And so they don't use ultrasound. They start using the mammogram, the x-rays at age 40. But I know that some clinicians do clinical breast exams. And so that's a palpation. That's more of a technique that's used by the healthcare provider to feel for any abnormal masses. And it's actually something that you can do as well as at home is even if you're not getting a mammogram or an ultrasound, it's still really important to be able to do monthly kind of self-checks, right? Self-tests to detect any abnormalities, whether that's a mass, whether that's any discolorations or any different colorings, textures are changing, any blood that's present in the breast. So those are all can be signs of breast cancer. But we know that starting at age 40 is when more cases of breast cancer occur. And so that's when they start the screening. But of course, if you have any questions, any doubts before that age, talk to your doctor, talk to a doctor, talk to someone and talk to them about those symptoms. They may still be able to run other tests and to be able to do other things to see if there's anything going on.
I think the Vanessa's comment is about the country because all of us coming from different countries. So for immigrants, the things are done differently, right? The doctors rely on different evidence and also the insurance coverage is different. So that's why I think there are like differences and there are different recommendations that are used in this country compared to other countries, right?
Yes, exactly. So there's different recommendations and guidelines that are used in this country, definitely. And so there's there's usually a board of doctors that review the research, right? And that they make recommendations so that the country, the doctors can follow those recommendations based on the research. And this is the one that I'm talking about here is the US. And so, yeah, it's based in the US, the US Preventative Services Task Force. And they give a lot of the recommendations for cancer screenings and other screenings here in the country. But yeah, that can be different from country to country, definitely.
Any other questions?
I see that there's a comment about breast cancer incidence. I also, see something about tap water in New York. Yeah, I mean, we see that definitely in certain populations too, right? Like I was saying, especially even if you don't have a family history, we're seeing that colorectal cancer, for example, the incidence of colorectal cancer is increasing not only in the US, but around the world, right? And so we don't quite know what the reasons are for that growing number of cases, but definitely researchers are doing the research. I know here at MSK, we are looking at colorectal cancer across the world. to see what the reasons are for that. But yes, it's very important to be in touch with your body, right? To know your body. That's the most important part you can do, and notice any changes. You yourself will notice whether you're feeling a little more tired than normal, whether there's anything wrong or anything different with your body, and checking in with your doctor, checking in with someone, right? And being your own advocate, right? In that space, because we all know, right? Doctors, especially here in the US, right, are very fast. They're very quick, right? I would say even for myself in a medical room, right, I probably spend maybe 10 minutes and I probably don't do most of the talking, right? And so I have to be prepared to ask the questions and to come with a list of questions and even a paper, right? Saying, hey, these are the questions that I'm going to ask you today, right? And showing it to the doctor and saying, I've been experiencing this because I know, they may not have all the time in the world, right? But if you bring that would be great. And advocate for yourself in these spaces. They're there to help you. They're there to help you find solutions. And so if they don't know, they won't be able to help. So you are your biggest advocate. And we can also help connect you to doctors again, if you don't have a doctor. That's probably my most important thing today, is to keep up with your doctor's appointments, go to your physicals, find yourself a doctor if you can, so that we can, so we can all stay healthy.
Comment about the New York water. I would say New York water is pretty clean compared to the other countries or states, but I think it may be the issue of the old pipes and old buildings when people may have contaminants in the water. What you would say? What would you say about that? The water? Yeah,
I agree. I mean, I love New York City tap water. So I do drink it. I don't know if that's going to be an issue, but I know lots of people that also drink it or even get filters for their water at home and or by tap water. But yeah, like you said, we had some news stories a couple years ago about bad pipes in schools, right? And they had to close down the water fountains in certain schools. And so, yeah, I mean, I don't know if we can necessarily clean everything perfectly, but I'm sure there are definitely different contaminants throughout the pipes as well. So.
Okay, any final questions, because we are almost at time now. So if anyone want to share a final question or final comment, you're welcome.
I see Vanessa says New York City tap water is the best. It is a pride for the city. I agree. I love my New York City tap water too. And I think it's the best tasting in the country. Feel free to send me a message, an email, call our number here for any information that you need about a cancer screening. We will also get in touch with you if you requested help on the registration page.
Thank you so much. Dana, you want to say something?
Yeah, absolutely. We really appreciate your time, Raúl. We look forward to our next webinar on Wednesday evening that will specifically address the issues around breast cancer. And we're so grateful that you were able to join us today. Thank you.
Thank you. Thank you so much. Thanks, everyone.